with my team, one of the best ways to drive transformative thinking is to imagine a world without, or imagine a world with, and start with really big ideas, really big thinking. I think especially in healthcare, because there's so much ingrained in the way it's always been. And that mindset, I find in myself, also gets kind of ingrained in what I call limiting beliefs of the way things have to be. And sometimes the best way to break that is to start from scratch. So imagine a world where, and really opening your brain to the possibilities, because I think too much we're trying to solve and transform around constraints that have always been there, but maybe don't need to be there, especially if you think big.
Welcome to Franklin Covey's On Leadership. I'm your host, Jennifer Colosimo. Today, I'm joined by Ryannon Frederick, Chief Nursing Officer at Mayo Clinic, a global leader in patient care, research, and innovation. Ryannon leads thousands of nurses and care teams in a 24/7 environment where the stakes could not be higher. She knows better than anyone that leadership is not abstract. It's the mindsets, language, and everyday behaviors that directly shape engagement, well-being, and the quality of care patients receive. In our conversation, we talk about the human-centered leadership that can ignite creativity, strengthen culture, enhance engagement, and improve outcomes across an entire organization. Welcome, Ryannon, to On Leadership. We're so happy to have you here.
Oh, thank you so much. I'm so honored to be here.
Obviously, with your role with the world-renowned Mayo Clinic, we want to talk about engagement and patient experience, but I do want to start with what I felt like was a really compelling LinkedIn post you recently made. And you asked your readers this question: how do you, as leaders, create and encourage transformational thinking, disrupt within your own sphere of influence? And I would love to hear from you that same question. How do you create and begin transformational thinking? How do you disrupt within your own sphere of influence?
Yeah, it's a great question. And I have to tell you, it wasn't a skill that was innate when I started really challenging myself and my team to think about disruption. I thought I was thinking transformatively. I was really thinking incrementally. And so it's really been a skill that I've had to work on as a leader. So the probably the first way that I really learned to think transformationally is as I work to better myself, educate myself. One of the things that I really like to do is go to education sessions, conferences that aren't in my industry. They're outside of healthcare. Because it is amazing how much transformation you can learn about in a completely different industry and then start to put that back into your own world. And so supply chain is a great example. And nursing and supply chain are not alike. But yet, as they started with some AI and automation and that pathway, there were similarities where I could draw parallels. So that's one way that I've grown it in myself. But I really have learned that with my team, one of the best ways to drive transformative thinking is to imagine a world without, or imagine a world with, and start with really big ideas, really big thinking. I think especially in healthcare, because there's so much ingrained in the way it's always been. And that mindset, I find in myself, also gets kind of ingrained in what I call limiting beliefs of the way things have to be. And sometimes the best way to break that is to start from scratch. So imagine a world where, and really opening your brain to the possibilities, because I think too much we're trying to solve and transform around constraints that have always been there, but maybe don't need to be there, especially if you think big. So that's how we do it within our Department of Nursing.
There's two big insights there. I really think our listeners will enjoy that you have found value in going to a supply chain conference, particularly as it relates to automation and the things that they're thinking about. Many of our listeners, of course, are in your profession in healthcare, but they're all over. And so many of the things we can learn are outside our industry. Big one. I mean, I can imagine when you just said to your team, I'm going to a supply chain conference. They were like, why?
Yes, I think it's hard at times in healthcare.
Oh, we froze, I think.
I think we did too. Okay. Do you want me to pick it up from the last question?
Yes, I'll just pick it up from supply chain conference and the depth of your questions. Imagine a world where, and imagine a world where that doesn't need to exist anymore. You know, you said you only need 30% of subject matter expertise on a topic to ask the right disruptive questions. So since this is so common across all of our listeners, you've given us a couple. Are there others that you found valuable?
Well, I think, goodness. First of all, I think trusting that the people who are closest to the work are the ones who know best where the opportunities are to solve. And they maybe don't know exactly how to transform it, but they know where the problem exists. So I would say that is another that is really important to me as a leader. We have a 4 nurses by nurses approach within our department at Mayo Clinic. You'll hear us use that slogan a lot. And it's because, transformation and disruptive thinking has to work for the people that are doing the work. And so that is one that is another place where we really try to pull in the people and ask them about their pain points so that we're solving together. That would be one. I would say another one is my team, the team that I am so privileged to lead. The core group of us that are our strategy team, they're not all nurses. In fact, the majority of them aren't nurses. And what I find is when you pull in the nurses that are doing patient care day in and day out, and you partner them with the right expertise and skill sets to ask some questions that somebody within nursing or that is a nurse would never ask, that's another, I would say, part of our secret sauce to really opening up transformative thinking. Because if I'm not in the clinical setting, if I'm not a clinician, I have all sorts of questions about why things happen because it's not innate. Whereas if I'm a nurse talking to another nurse, well, that just makes sense. That's just the way we do it. So that is another, I would say, one of those tools that we've built over the last few years to really open up how we think transformatively and how we build skill sets on top of each other to really make us stronger as one department.
It seems like that would require a level of trust. You know, just our research, Franklin Covey research has found that 87% of leaders see disruption as a threat. So is there a way that you create safety to collaborate across these so that it's not as threatening to think of new and better ways, or even think, oh, I'm not sure I want to share my opinion on that. I don't feel safe doing it. How do you create that environment of trust?
It's hard. I think in healthcare, trust is something as a nurse leader, we work very hard on no matter what we're trying to do. Because, nurses are heart leaders just as much as practical business leaders, and having that support from our teams in order to move forward is essential. So lots of different ways that we've worked to build trust. The first one is just the way we communicate. We listen to the teams that are doing the work. We work hard to have open, transparent communications. For me personally, I really try hard to be myself. I think at times as nurses, we're very worried about proving ourselves in very competitive environments at times with incredibly smart individuals, and needing to be at the top of our game. One of the things that I take great pleasure in, although sometimes works, some doesn't, is I'm just authentically me. I try really hard not to plan too far ahead or to prepare my words in advance, because I find when I'm just me, that resonates with people. So that's one piece. I think another one in building trust, again, our for nurses by nurses approach. And so having the teams who are having their hands on patients every single day say, this is the problem and we need it fixed. And we say, okay, and now you're part of the team who's building the solution, and having them see that their feedback, their ideas, and their actions are leading to something different to solve a challenge that they felt needed solved. That is huge in building trust. Like, their voice matters at Mayo Clinic. And I want my actions and our work as a department to reflect that every single day. And that really works to build trust too. I mean, there's also little things, just following through on your commitments, and jobs as big as mine, as ours, as leaders. That's really hard at times, because we have so many competing priorities. Taking time to remember people, remember their names, remember their actions. Those are little things. I mean, I lead 26,000 people, but I want every single one of them to feel like they are seen and they are heard, and that their contribution matters at Mayo Clinic. And so those are just some of the ways I try to emulate that as a leader. And I had role models who did that for me. And so I know how much it makes a difference.
Well, I mean, you're saying, oh, they're just small things. But if you think about it, building trust is small, daily, actionable behaviors. And you said some amazing things. One, really listening, and then demonstrating that the feedback you provided, we acted on or not. But we're clear on why we didn't act on it. I would guess that's true. Also, the just remembering small things. I mean, creating a culture of positive in addition to when there needs to be constructive, and authenticity. You're you. And are working on your own leadership and are continuously working to disrupt, but really bringing yourself versus trying to be someone else. Transparency, you listed some amazing behaviors. And so as you think about that philosophy that you're bringing as the leader of 26,000 people, how do you bring that throughout the organization, building engagement, of course, with your nurses and all of the other functions, both clinicians and other? How do you bring engagement, or is there anything in particular you measure behaviorally?
Well, I think from an engagement perspective, we measure it through participation, through excitement, through execution, through outcomes. So engagement doesn't happen without that. You can't get the best patient care in the world if you don't have staff that are incredibly engaged. So that's what I would say, that kind of the way that we measure it. And I'll give you an example. We just did a competition in our department where we wanted staff to help create our future through agentic solutions. We wanted them to tell us what the pain points were where an agentic solution could solve, and we wanted them to actually be the creator of the solution. We work really hard on communication. We work really hard on education so that they're set up for success in this. But the competition was basically put out to the entire department, and we thought we'd maybe get 100 or 200 ideas submitted at best. We had 458 ideas. It was the first time in my career we were planning on sending out like a reminder email to get more ideas submitted the week before it closed. And we actually paused because we had so many ideas submitted initially. We already knew it was going to be so hard. And so it's signals like that people, I think so many people think about, well, how did you get your staff ready? The reality is they're already ready. They already want to be part of the solution. And if you provide them with the tools and the resources, they're going to jump in. AI, for example, people have been using that for years. And it's not always as new to them as what you think it is. And so that's how we measure engagement. It's just in participation, communication, and what we see from our workforce. And then that engagement also plays out into that discretionary effort for amazing patient care, the way they take care of their colleagues, the way that they go above and beyond. You know, when I see an employee stop in the hallway and help somebody because they're lost and they don't know which way to go to get to their appointment, that's all measures of engagement of our staff. And so I watch, I listen, I look for those signals and signs every single day. And I'm very fortunate. Nursing isn't the only discipline that does that. I'm surrounded by brilliant physicians and scientists and communications colleagues and everybody at Mayo Clinic. And it's, you see it in every single discipline as part of our culture. And we not only support it at the individual level, but we support it within our teams. And that culture will just continue to spread. Once you have it, it spreads because other people see it and they want to be a part of it.
And there's a tipping point. I would guess that there are leaders listening to you, whether in the hospital setting or outside of hospitals, that are thinking, I want Jen to ask a deeper question there, because we work quite a bit with hospital systems healthcare on employee engagement and how it impacts patient experience. And your 458 ideas as a spectacular signal, as well as how they're helping each other in the halls and collaborating across very different disciplines and mindsets, while in most cases is there to some extent, may not be at the level that you're experiencing at Mayo Clinic. So while it may seem small to you, I'd love to hear some of the things you do systemically to build that level where you get 458 ideas.
A lot of it starts with leadership development because we know that our staff emulate what they see from their leaders. And so really starting at my level, role modeling, pulling in the leaders that report directly to me, working with them to have the conversations about how are they pulling the leaders underneath them. I mean, I have a large system. We've got campuses in Florida, Arizona, Rochester, and then a Midwest campus, which is quite large. And so really, you know, starting with my team and how I role model, but also how I pull in, how I develop them so they're thinking about how they're doing that. We learn from our failures. So there are times where we can see that we didn't necessarily hit the right mark. But that's not a problem in the sense of it's not a failure. It's a learning opportunity. And we use that to say, okay, what went well here? What could we have done differently? And how do we carry that learning forward? So those are all pieces that we do. I also work really hard as the leader for the largest clinical department to have alignment with my colleagues across the organization. I don't want nursing to be functioning in a silo. So then when we have this great idea or great momentum and great engagement behind it, because we typically do, it gets stuck at the organizational level because I didn't do my due diligence first. And so like that agent competition example I gave you, that was aligned with our organizational strategy and objectives. And I knew that before I prioritized it. I also vetted it with some of our key stakeholders that would need to help us move those ideas through the organization. And so those are all, you know, in order for the staff to see their ideas move forward, you have to lay that foundation and that framework. And so I work really hard to do that, kind of all levels, above me, around me, and below me. And they're all equally important as I think about how to spread some of that engagement and that excitement about the ability that nurses have to lead the future of Mayo Clinic and the future of healthcare.
More than 1 in 4 nurses expect to leave the profession by 2027. Think about that for a second. A quarter of the people taking care of us planning their exit. And every time one of them walks out the door, the cost of covering that gap falls right back on the hospital. Here's the thing, though. It's one of the greatest leadership responsibilities and opportunities in healthcare. Franklin Covey has a free guide called Caring for the Caregivers. It's a 6-step playbook for chief nursing officers and hospital leaders who want to enhance nurse engagement. There are hospitals already doing it and actually turning the disengagement around. The guide is in the show notes if you want to see how. Okay, let's get back to it. Well, some things I want to point out. You aligned with strategy, and you have strategy on one side, you have the technology and the automation ideas on the other side, and then you have human behavior. You know, at Franklin Covey, we say that is the human edge of strategy, that human behavior. There's a few things I want to tease out for our listeners. I often find at certain levels, and this can be in your industry or other industries, people get very good at leading a team. There's that shift from when you were an individual contributor to leading a team. Yes. And they get strong there. And possibly, especially as you move to different levels in the organization, you get good at working upward and effectively. The peer piece is often missing. Is there something in particular, a story or a reason, something that helped you learn that? Did you have a good model? I often see them thinking, no, I'm really good at this function. And the person I report to thinks I'm great and miss all the benefit and collaboration and awesomeness of your peer stakeholders.
When I started in my role as the system CNO, I was really struggling with the team directly under me. And what I saw was a group of amazing individual nurse leaders who were each working hard to execute the highest level of care delivery at their individual level of responsibility. But what I didn't see was our ability to cohesively say what's right for the greater good of Mayo Clinic patients, Mayo Clinic staff, and Mayo Clinic, and how are we moving forward that together. And it was frankly almost always a competition between group interests and individual interests. And I would say I had to figure out as a leader, how do I get this group of people who come together and are a very effective group who share information to move forward as a team with a cohesive plan, understanding that we're here for each other and the greater good. There are times where we have to move together because that's what makes sense. And there are times where we have to move separately because we have specific needs for our patients or for our staff at our sites that are really unique. And even just that exercise to think about the difference at my level, at our level of the organization between a team and a group was the first eye-opening exercise. And I was experiencing it in my team every single day because my job is to elevate enterprise or system work. That's not necessarily the way they viewed their job. Once I realized that I was struggling with that within my team and really kind of figured out how to get us to gel and move a little bit differently, then I recognized it in myself and with my peers. And that's when we really started a priority we call co-elevation. And co-elevation is really, how do I be a partner to help a colleague hit their goals? And it might be that that's not my responsibility, but yet as a good peer and a good colleague, that is what we're here for each other for, is to do that. And so co-elevation is one of those principles that we really have spent a lot of time thinking about. And really, it pays forward, right? If I co-elevate somebody else in the future, they're going to co-elevate me or somebody on my team. And so those are some of the principles I've really used to think about that. And that's my story. I mean, I have to tell you, from where my team started to where they've come, it's amazing. And I can say undoubtedly they're a team. And that didn't happen by accident. That took deliberation and focus and really kind of thinking through the difference and where we were showing up as a team and where we weren't. So that's one thing that's really helped me in my career.
Co-elevate, and there is both mutual organizational, patient. There's so many outcomes that happen through that co-elevation. Is it brought up regularly in meetings? It isn't. I don't think, you may think different, I don't think it's natural for people to think about, especially when you're a deep expert who's doing everything right, to think about, how do I co-elevate in all directions? Is there a way that you keep it front and center?
We talk about it quite a bit. And I will say one of the strategies that I use to keep it front and center is that at times people want very, very black and white roles, responsibilities, expectations. And the role is to co-elevate. The role is for us both to figure out how we can contribute to our mutual success. So to be frank, I lean away from black and white roles and expectations and accountability frequently. And it drives my team crazy because at times they just want to know, what am I accountable for? Ryannon, just tell me, what is it that you're expecting of me? And I will be very clear. I'm expecting this project to be successful, and you're all at the table and responsible to make that happen. And together, you need to figure out how that's going to happen. And that's part of co-elevating. So that's really how I do it. I also really question, anytime things don't go well, was there something I missed in helping set that up for success? If it's at the organizational level, if it's within our department, did I co-elevate the way that I needed to? Because I think the reality is these are hard jobs, and nothing in healthcare happens in a silo, especially with nursing. Nursing is at the center of every single piece that touches the patient. We are always impacted. And one of the traits that I see in my profession is we get frustrated with every other group when they do something and they don't ask our permission or they don't know how it's going to impact us. And again, I really believe the best way to solve some of that is by role modeling it right back at them. And so to me, those are the strategies that I use to keep co-elevating in the forefront. And then I also really recognize when people do it and do it well, really wanting to recognize that. We have forums internally. We really are trying hard to get our story out externally. And so that is a piece of what we try to do as well.
There's a confidence and a humility at the same time that in terms of traits that you see in leaders like yourself who can bring it all together. I don't know everything about anything, but I also know a lot about this, and here's what I'm bringing to the table. So of course, our listeners that are US based, globally based, people know the Mayo Clinic. When you think about this great work you're doing to build leaders, to build teams, to build collaboration, to build engagement, how do you make direct links for yourself or for your team to patient experience and patient outcomes? Or if I were in that field, I've worked in healthcare, but not as a nurse or a clinician. If I were in that field, would it be self-evident to me? Do you have to make something explicit between engagement and patient, or is it that makes logical sense?
I mean, it's both. It's both. It's a great question. And I would say in nursing in particular, it's very intuitive to a nurse how their impact helps patients. But if you don't specifically call it out or tell those stories, it doesn't necessarily click always, or they don't feel recognized for it. And so part of it is telling the patient stories about our impact really helps reinforce our why. No nurse goes into healthcare because they want to make a ton of money. No nurse goes into healthcare because they want to start with AI and transformation. That's just not typically the path. People go into healthcare because they want to make a difference for people and for humans. And so starting with the story and kind of reinforcing in our why is really, really important. We have a nursing forum that we do quarterly, and we always start the nursing forum with somebody from our department, a staff nurse, a PCA, a HUC, someone from our department with their why. Why did they start in healthcare? What was their story? What is their journey? To really ground us in why we're all here and remember that. The other piece that we do is we talk about impact. I think so often in healthcare, we get really focused on outcomes. Did the patient fall? Yes or no? What's our fall rate? What's our infection rate? We really try to think about, and what was the impact of that? If for example, I can cut 15 minutes from the amount of time I spend every day documenting, because no nurse wants to document. That's not what we became in healthcare for. But the impact of that is now I have 15 more minutes that I'm able to connect with my patient and learn about them and understand their goals that I can incorporate into our plan to help make it so much more effective. That's the impact, and that tells a story too. And so those are two of the ways that we really try to ground that connection with purpose, not just for purpose for our patients, but also purpose for ourselves, and really connect that to the work that we do every single day.
You pointed out something that, of course, exists in healthcare, but also for so many leaders. We have, and we should, multiple things we measure. You know, you went through some of your list of the quality checklist and the scores and all of the things that are good. We're held accountable. We're looking externally. We're looking internally. And financials, there's all the components we look at, but grounding in telling the stories about why, looking at our impact in addition to the data, and what doing some of these things will do in terms of the impact and the reason we're in the profession. I don't want to go forward without thanking all of your nurses and all of those listeners that are nurses. Such an impact you've had on every other listener's lives. So before we end, thank you. And I also have visited a Mayo Clinic accidentally with a torn cornea. You're one in Arizona. So excellent care. Thank you for my visit with the torn cornea from stumbling into a cactus.
Oh my goodness.
I know, not a good thing. They were like, your eye, really, I hope you can still see, which I can. Thank you. So before we end, is there something, we've talked a lot about connection and impact and purpose and driving engagement, some really tactical examples. Is there anything from your leadership journey? I believe you started your career at Mayo. Is that correct?
That is correct.
Listen to you, that over your leadership journey, just a lesson that you've learned either from a leader that you followed or over time that you'd leave our listeners with?
Gosh, I've learned something from every leader that I've ever had the privilege of working with and for. I think the one that I would choose is that sometimes the individuals that I was working for that I thought were the most challenging for me to get things right or to hit the mark, those were the people that actually challenged me to be even better and think bigger than I ever imagined that I could. And so at times where I felt like I was failing and I felt defeated, what I recognize now is that that leader actually helped me see the potential in myself that I wasn't seeing. And what a blessing that is to have somebody who's willing to push you further than what you thought you could even go. And I honestly, a lot of my work around transformation is happening because I have leaders who have pushed me in that space. And it is so rewarding and so fulfilling, but I've grown so much through that journey. So that's maybe the one that I would leave with. I think sometimes people are quick when they have a leader that they think is tough or hard to think, I'm done, I'm out of here. But I have to tell you, I've grown the most under those leaders, and I would never change my career pathway or my trajectory to take that away. It's been amazing.
Thank you so much, Ryannon, and thank you to our listeners for joining on Leadership. We'll see you next time.